Today, with the lockdown and the problems that we are facing as a result of the lockdown, mental health seems to be one of the large concerns of the people around. And so today I want to explain to you the difference between a counsellor, a therapist, and a psychiatrist. Very often we go to a doctor that we're not supposed to see, and we bring on ourselves problems. The other day I was talking to a friend of mine, and mine said to me, when I go to this clinic, all that the doctors are looking at is prescribing a medication. I don't know why doctors do that when we are come there for some mental health problem. And so today I thought, let me explain to you the difference between a counsellor, a therapist, and a psychiatrist. To my good luck, I am doing a counseling workshop, and in our first class of the workshop, the professor that took our class explained to us the difference between the three. And so here goes. A counsellor is a person who deals with mental problems of a slightly lower level. And when I say lower level, when you have a cough and a cold, you will not go to visit a surgeon. You will go and visit a general practitioner. So when you have problems that are mild to moderate of anxiety, or if you're having issues in relationships or emotional problems, the person that you're going to see is going to be a counsellor. A counsellor is trained in certain skills that will help you to understand your problem and to find a solution to your problem. The person who is a counsellor studies their masters in psychology and does training under a senior counsellor to develop the skills. You have the second type, that is the therapist. Now, a therapist does 2 years more of studying. So a therapist will do a master's in philosophy and MPhil in mental disorders. Now mind you, a therapist is trained to deal with a specific disorder or a specific set of disorders. A therapist learns the certain techniques. A therapist would learn a technique called CBT, which is cognitive behavioral therapy, or will learn certain techniques to deal with specific problems. So you will have a specific therapist that deals with clinical depression, or another that would deal with severe anxiety, or another one that would deal with schizophrenia or substance abuse. So they are specifically trained in a particular methodology. Maybe they would be trained in hypnosis to help you to handle your problem. So if a counselor finds that you have a problem which is not so minor and you require some more detailed help, the counselor will recommend you to a therapist. Now, a therapist, when they see you, the problem is already sort of diagnosed. They have the training to handle certain psychometric tests, and they are able to get you some therapy. Now, if the therapy that they're doing is not enough, they will work with a psychiatrist, and a psychiatrist is one who studies how to administer certain drugs if the therapy is not enough. So, when you choose a doctor to deal with your mental health, don't directly go to a psychiatrist and then say, oh, they're prescribing drugs. Go to the right doctor. If you require a little bit of counseling, go to a counsellor. Counselor will be able to assist and help you. If your problem is a little deeper, go to a therapist. If a therapist recommends that you go to a psychiatrist, then the therapist will work alongside the psychiatrist to help you to deal with your problem. The psychiatrist will prescribe the medication and the therapist will give you the therapy. I hope that this has cleared your confusion with regards to the doctor that attends to you when you have a mental problem. This is Teacher Grandma just trying to make your life a little easier with the little knowledge that she does have. This is Teacher Grandma signing off, saying bye-bye.